Hey there, how's it going? It is your muscle building and fat loss coach, Lee Hayward. And in today's video, we're going to discuss TRT, testosterone replacement therapy, as well as HRT, hormone replacement therapy, and discuss the pros, the cons, who's it for, what it is, and whether or not this is something that you should consider, especially as a man over the age of 40. And that's who I primarily focus on gearing my videos towards now, because I'm a man over the age of 40. And this is something that I can certainly relate to, and I want to discuss this topic now in detail in this video to help give you a better understanding of how it works and what's involved with it. So first off, without further ado, let's just jump right into it. What is TRT or HRT? Well, TRT, testosterone replacement therapy, is basically replacing your testosterone levels with synthetic forms of testosterone, whether that be an injectable testosterone, whether that be a cream, a patch, implant pellets. I mean, there's all kinds of different methods of delivery. Injectable is the most common and the most efficient, but basically it's a synthetic form of testosterone. Hormone replacement therapy can encompass testosterone replacement therapy, but it's a much broader spectrum because it not only covers testosterone, but it can cover growth hormone, it can cover thyroid hormone, and other metabolic hormones that are produced in the body. HRT is what you should really be looking at because it's the broader spectrum. Testosterone replacement therapy is just testosterone in isolation. Now, sometimes, again, the terms are thrown around back and forth interchangeably, but ideally, if you are looking for this and you're asking your doctor about it or whatever, you should be looking into HRT, hormone replacement therapy, because testosterone by itself, while that's the big one, that's like the 80-20, if you will, like that's the big one that's going to give you 80% of the results. There's a lot of other hormones in there that come into play as well, and it's important to have all these hormones in optimal levels. Now, why is this even a big deal to begin with? Well, as we age, our hormone levels naturally decline. And again, testosterone is the major one for men, but this applies for all the hormones, like growth hormone, thyroid, those hormones decline as well. But again, the main one that we're going to focus on in this presentation, and the main one that you really look at when it comes to hormone replacement therapy, is testosterone. And that's why very often people will refer to it as testosterone replacement therapy versus hormone replacement therapy, even though, as I mentioned earlier, ideally, when you're looking into this, you want to get all your major hormone levels checked just to make sure that everything is in balance. But the one that's going to have the biggest bang for your buck, the biggest impact, is the testosterone. And that naturally declines as we age. So going through childhood, we have low testosterone. Once you hit your teenage years and then go through puberty, then the hormone levels just go on bust, right? Everything just amplifies, and that's what takes you from a boy to a man. And by the time you're 20, you have optimal hormone levels, right? Optimal testosterone, optimal growth hormone, like everything is at its natural peak by the time you're 20 years old. And then from that point on, it slowly starts to decline. So over the course of your 30s, 40s, 50s, 60s, and beyond, the hormones are going down about 1% per year. Now that's normal. And that's why you have like the young man who's lean, strong, and athletic, and then the old man who's weak and frail. Like that's the natural part of aging. However, today, what we're seeing more and more is lower than normal hormone levels, especially testosterone. And it's quite common to see guys in their 30s and 40s and 50s who have exceptionally low testosterone, especially compared to generations ago. Like, it's common today for men to have lower testosterone than their grandparents or their great-grandparents. And a lot of it has to do with food choices, has to do with lifestyle, just the way that we're living these days, not as active, more sedentary, more processed foods, and not as much quality sleep. All these things can have a negative impact on your hormone levels, and it's quite common to see guys who are even in their 30s, 40s, and beyond with exceptionally low hormone levels. Like, you might see a man who's in his 40s who has the testosterone of a 70 or 80-year-old, and obviously not experiencing the quality of life that he should be. And that's something that I'm going to get into in more detail now within this presentation, and actually share some examples of people that I know personally who've gone through this. But here's just a general overview now. I mean, testosterone is the major hormone that makes men men, and it helps with sexual features and reproductive functions. It also helps you to build muscle mass. It helps to improve red blood cells. It helps to increase bone density, and it gives you that sense of well-being. It makes you feel confident, it makes you feel strong, and it makes you feel like a man. And if you have low testosterone, very often you will have a low sex drive, erectile dysfunction, a decreased sense of well-being, and even depression. Sometimes you have difficulties with concentration and memory, moodiness, irritability, low energy levels, a loss of muscle and strength, and an increase in body fat. And these are common things that we see as people get older, right? Sex drive goes down the toilet, right? The erectile function is not working like it should be, right? Just your overall sense of well-being is down. Very often you feel depressed, and a lot of times that could be related to your sexual function. I mean, if everything's not functioning down there, it's hard to feel good up here, right? Like the penis and the brain are connected, right? Like if the penis is working good and everything's good down there, very often you feel good up here. If it ain't working good down there, it very often doesn't feel good up here either, right? There's a direct connection, I'm telling you. And just overall, your moodiness, your energy levels, your sense of vitality, your strength and your athletic performance, like it's all related. And very often when you have low testosterone levels, you just see everything start to decline. And that's why very often we see guys who are overweight, out of shape, just fat and lazy and not very interested in sexual activity, not very interested in kind of getting out there and taking on new adventures and challenges. A lot of that stuff has to do with low testosterone levels. Right, the more testosterone you have, the more you feel like a man, and the more challenges you're willing to take on, the more you're willing to live life to the fullest. When your testosterone levels are low, your quality of life is often low as well, and it's a correlation that goes right through. And unfortunately, when you go to your doctor to talk about this, the doctors are very hesitant to prescribe testosterone replacement therapy, except in extreme cases. Like if somebody goes with a low normal testosterone, very often the doctor will say, well, you're still in the quote unquote normal range, be happy with that. Like, why do you need more testosterone? Like, be happy with what you got and continue on. And a lot of times if people say, well, hey, I'm feeling, a decreased sense of well-being, I'm feeling depressed, right? I'm moody, I'm irritable, I have low energy, and all these things, these ones right here, a lot of times the doctor will then misdiagnose the low testosterone for depression. And this is quite common. You see this a lot, right? And people will be put on antidepressants when the root problem isn't necessarily depression. It could be low testosterone. Now, again, this is something you'll have to discuss with a medical professional. I mean, because don't get me wrong, there are situations where people do need antidepressants, right? I'm not trying to say that that's bogus. There are certain situations where people absolutely need them, but sometimes, and it happens quite often, where low testosterone could be misdiagnosed as depression, and you'd be put on antidepressants, when if instead you were put on testosterone replacement therapy, that could help to cure the depression along with all the other problems, the low sex drive, the erectile dysfunction, the lack of muscle mass and energy, the increase in body fat. Like a lot of that stuff could help to improve, as well as your sense of well-being and your confidence and everything else. So it's a big one, and it's something that needs to be discussed and tested through blood work, talking to your doctor. And it's something that you just don't want to self-diagnose yourself on, right? I'm not recommending self-diagnosis here. I'm just putting this presentation out there to help make you more informed. Now, to put some numbers here, these are the normal testosterone levels for men, or the averages, if you will. So a low testosterone level is 300 nanograms per deciliter. An average testosterone level is up around 650 nanograms per deciliter. And a high testosterone for someone who's like in their 20s and in the peak is around 1,000 nanograms per deciliter. So this is where you should be. So like the average man should be somewhere around average testosterone. That's where you should be functioning. But unfortunately, as I mentioned, a lot of people are in the low range because of lifestyle choices and for numerous factors. It could be genetic factors or whatever, but it's more and more common to see men who have low testosterone, or even below low, like below normal low, that is. And it's quite common. Like, in fact, I've seen some numbers recently saying that upwards of 40% of men over age 45 have low testosterone. And if you have low testosterone, you're going to experience a low quality of life. And just to kind of give you an analogy of this, like imagine your income level, right? I just want to use this as an analogy. Here's the average income in the United States. So the poverty line is $12,760 per year. Now, imagine that you are just above the poverty line, right? So maybe, okay, you're making $13,000 per year, which works out to like, I don't know, $35 a day. Like, technically you're above the poverty line. So like people would say, well, hey, don't be so greedy. You got enough money. You're not in the poverty line. You should be happy with that. And that's almost like a doctor telling you should be happy with low normal testosterone. Like, why do you want high testosterone anyway? Like, be happy with your low average normal testosterone. Well, it's like saying, hey, be happy with your low income. I mean, just think of the quality of life that someone's going to experience just above the poverty line versus if they were in the average income, which in this case is $51,916. These numbers are they're accurate as of the time of this video. I just did a Google search to see what the average income was before I made this video, and just to put these numbers out there. So imagine you are at the poverty line versus average. Think of the quality of life that you would be able to experience between those two different income levels versus even if you were in the high income, say like $100,000 or more per year. Think of the difference in the quality of life that you would experience at that level, right? The same can apply to your hormones. Like, you could be just surviving and getting by at just above the poverty line. I mean, not having money for a car, not having money for any exterior luxuries, nice clothes or a vacation or anything like that. I mean, you basically have enough money to eat and stay alive, right? Same when it comes to your hormone levels. Like if you're up here in the low testosterone, okay, you have enough testosterone to function, to stay alive, but it's far from optimal, right? I mean, most of you watching this video, I'm sure that your goal is more than simply survive. It's probably to thrive, to optimize, to be at your best, to live life to the fullest. And simply surviving ain't enough, right? Like, if you go to your doctor and say, hey, I'm happy with just surviving, like, that's usually not where you want to be. You want to be at least in the average range or even in the high normal, right? You want to be up in these areas so that you can thrive and feel good and confident and live life to the fullest. That's where you want to be. Just the same as in your income bracket, you're not living life to the fullest, just scraping by at the poverty line, right? You want to be at least in the average or in the high range so that you can live life to the fullest, right? That's where you want to be. And it has a huge impact on the quality of your life. So this isn't just survival. This is about optimization. That's what it's all about. It's about feeling the best, living the best. I mean, and why not? You only go through life once. Why not live it to the fullest instead of just scraping by? Now, I want to share an example here of somebody who was trying to live life to the fullest and had some issues with low testosterone and hormone replacement. This is Jason Golden. Here's a guy that I personally worked with. He went through our Muscle After 40 Blueprint coaching program, and he actually made a really good transformation naturally. Went through it, like lost a lot of body fat, built some muscle, increased his overall health and fitness, and really made an impressive before and after transformation. And this was Jason's before and after transformation going through the Muscle After 40 Blueprint. I mean, you can see he lost body fat, increased his muscle mass, made a really good transformation. But he got stuck at a plateau. And even though he lost the body fat and was still happy with his progress, he wanted to start to improve his stamina and wanted to improve his muscle mass, improve his strength. And even though he was following a proper nutrition plan, even though he was consistent with the workouts, consistent with his lifestyle choices, like avoiding alcohol, getting adequate sleep, like doing everything in his power to improve his health and fitness, he still was stuck at a plateau, and for months, was at this level where he couldn't make any progress. He was kind of stuck in that after picture, if you will. As he says, long way to go, but he's getting there. Well, he was stuck in the getting there phase, right? He was really frustrated with this. And I was working with him, trying to help him optimize his nutrition, help him optimize his workouts and everything else. And despite that, nothing was working. He wasn't seeing much in the way of change. And then I suggested, have you ever talked to your doctor about hormone replacement therapy, or at least to get it checked? Because again, Jason's in his late 40s now, and he's in that range where this becomes an issue, right? The older you get, the more serious this becomes. Now, from a practical point of view, I'd recommend anybody after the age of 30, when you go get your physical and your checkups, get your testosterone levels checked just to see where you are. But especially if you're over the age of 40, you definitely want to get this stuff checked, because this is important. This can mean the difference between having an okay quality of life and a really good quality of life. Now, in Jason's case, he went to his family doctor, got tested, and he found out that he had the testosterone levels of an 85-year-old man. Despite the fact that he was eating healthy, despite the fact that he was working out and taking care of his life, to the best of his ability, he had low testosterone levels. And that's when he had to look into hormone replacement therapy. And he went to his family doctor for this, and even though he had low testosterone, his doctor refused to give him testosterone replacement therapy. And he had to look outside of the doctor for other alternatives. So he ended up going to HRT. And HRT is a hormone replacement clinic. They're based out of Illinois, and IAM stands for Illinois Alternative Medicine Hormone Replacement Therapy. IamHRT.com. So if you want, you can go check them out. And they are a nationwide clinic. So even though they're based out of Illinois, it's a virtual clinic, meaning like you can call them, you can do video consultations with their doctors and their clinicians at their clinic, and you can do so virtually. And that's what Jason did. He contacted them, had a virtual consultation, got the blood work done, and ended up getting prescribed hormone replacement therapy through that clinic. And he actually shared this on our private group. And he said here, in the name of transparency, I present to you my new reality. Keep in mind, I've been working with a medical professional for nearly a year in search of relief from the symptoms I've been experiencing. Chronic fatigue, lack of energy, low libido, irritability, anxiety, depression, and a few other low T symptoms have been plaguing me for a long, long time. Now, keep in mind, he was already following a healthy diet and exercise and lifestyle choices. Like, he was doing everything to his own ability, but he still was suffering from these issues. Right? Low energy, low libido, depression, like not feeling good, right? Not feeling good despite the fact that he's eating right, exercising, and doing all the stuff that he is supposed to do, right? The hormones just weren't there to back it up. He says, it wasn't until I began having blood drawn and the panels reviewed by a physician that I discovered the root cause of these symptoms. We started with some peptide therapy, but that really didn't seem to make much difference. After a few months, we switched over to human growth hormone in an effort to increase my IGF-1 levels. In 6 months that I've been using HGH, my IGF-1 levels have risen some. While this has assisted in many ways, the symptoms of low T have persisted. After my most recent blood draw, it became apparent that my free testosterone and estradiol levels were still those of an 85-year-old man. Not ideal. So I've been prescribed testosterone injections along with HCG in addition to my HGH injection. The testosterone will help to bring up my free testosterone and estradiol levels, and this should offer some symptom relief very soon. HCG will prevent testicular atrophy and allow my body to continue to produce testosterone naturally, even in small amounts. All right, so basically, he went to his family doctor, was diagnosed with low testosterone, and they still refused to give him testosterone replacement therapy. So he went to the clinic, HRT, and talked to their doctors and their clinicians, got tested and did his consultation, and they prescribed him the testosterone replacement therapy that he needed, along with the other hormones. So he's also getting HCG, which helps to increase your natural testosterone. He's got human growth hormone there as well. So he's got a full spectrum of hormone replacement therapy based on his blood work and what his body needs. So again, it's not a crapshoot. Like, they're doing blood work and testing and seeing what your body needs. And then, of course, he has to follow up with them on a regular basis to make sure that he's in the optimal levels. And this was an update that he posted just after starting the hormone replacement therapy. He says, 4th overall testosterone and HCG injection this morning, along with the daily HGH. I can't begin to tell you how much better I feel on a daily basis since beginning TRT. Experiencing symptom relief is a great feeling. It has come, however, with a few side effects that are tolerable and temporary. He's sweating a lot more now, and he's retaining some water, and he says that he has to work on that. And that's something that's quite common. Like, when you go from having low testosterone levels to now optimal testosterone levels, there may be some water retention there as well. So I mean, that's something he's going to be working with, to adjust the dosages accordingly to make sure that he's optimizing the benefits and minimizing the side effects. But a little bit of water retention is a small price to pay, and a little bit of sweating, from the feelings of depression, low energy, erectile dysfunction, all that kind of stuff, right? You got to look at the pros and the cons. So again, I'm not saying that there's no side effects. There are some potential side effects here, but that's the purpose of working with a doctor, getting blood work done, and ensuring that you have optimal levels, and they can adjust the dosages accordingly. Because we don't want too high a testosterone, and you don't want it too low, right? You want it in that optimal normal range. That's what we're shooting for here. What is he saying? Like, overall, things are progressing very well with the hormone replacement therapy. I'm basically on par with where I should be based on the dosage, the amount, the frequency, and the duration of the therapy. So, bottom line, this is something that can happen very quickly. Like, within just 4 injections, he's noticed an improvement already. So I was actually just chatting with Jason recently, and he's very pleased with how things are going. Like, this has made a big difference, and now he's getting better results with his workouts. You know, his strength and energy is improved, his confidence is improved, you know, his quality of sleep is improved. Like, he's starting to feel the effects that he should be feeling from all the work that he's putting in with his diet and his exercise program. Now he's actually able to maximize that, whereas he was really stuck at a plateau before this. So again, it really goes to show the power of hormone replacement therapy when done under medical supervision and done in the right amounts. And where this gets confusing is when people think of, you know, abusing steroids and hormone replacement therapy. And I mean, I can understand that, because a lot of times people who don't know the difference, they think, well, any use is abuse. And that's almost the same as saying, like, hey, I'm taking an aspirin because I have a headache, or I'm, you know, chewing down a handful of aspirin because I want to get a buzz, or whatever, or I'm having a glass of wine with dinner versus I'm drinking a whole bottle of whiskey because I want to get shit-faced drunk. Like, use and abuse, there is a difference, right? And there's a difference in terms of the side effects and the benefits and the risks and all that kind of stuff, right? Same applies when it comes to hormone replacement therapy. When done under medical supervision, proper use in the right amounts is actually quite beneficial, and it can outweigh of just letting your hormone levels naturally decline and then suffering the depression and the side effects that come along with it. I mean, you got to look at this from a broader perspective as well. Like, one of the biggest causes of death for men is suicide. You know, like, people, they get depressed, they don't feel good, they don't enjoy the quality of their life, and it's like, well, what's the point of living anymore? And a lot of that has to do with testosterone and your overall hormones. So, I mean, if you don't feel like a man, you know, your confidence is low, your pecker isn't working, so, I mean, you have erectile dysfunction, you have low sex drive, you're not able to satisfy your wife, I mean, and you just have low energy, it's like, what's the point of even living anymore? And a lot of guys go through that, and this could be corrected with proper hormone replacement therapy. Now, again, I'm not saying that this is the end-all be-all, but it is a factor to consider. It certainly is. So sometimes you need to look at the bigger perspective and think, like, is the risk of having, you know, supplementing with testosterone and the few side effects that it could potentially have, like increased water retention, it could potentially increase blood pressure, you know, if it's not monitored. That's why you need to monitor the dosages and the amounts accordingly to make sure that your blood pressure and water retention and everything else stays in check. But if you do that under medical supervision, it can be done quite safely, and the risk to benefit ratio and the rewards could be in your favor. But again, it's something that you need to discuss with, you know, either a hormone replacement therapy clinic or your family doctor. And in Jason's case, he did go to his doctor and they declined him for hormone replacement therapy, so he ended up going to the clinic, and he got the help that he needed. So that was the alternative. And it's unfortunate that it has to be that way, because I know in a lot of cases, if a woman goes to her doctor for female hormone issues, the doctors are usually very willing to prescribe female hormone treatment. Like, for example, if a woman goes to the doctor and says she wants estrogen for birth control, there's very low likelihood she's going to get turned down. You know, if she's going through menopause and she needs some treatment for that, it's very unlikely the doctor's going to turn her down. But when a man's going through what we call andropause, which is basically the symptoms of low testosterone, very often the doctors say, well, hey, you're still in the low normal range, be happy with it. You know, it's not that bad, right? Suffer it out. and they deny you of the treatment. So it's kind of unfair. And again, this is a generalization, right? There's always going to be exceptions. You know, some family doctors will be more than willing to help prescribe testosterone if needed. But more often than not, they're very hesitant. And that's where going to a clinic such as I Am HRT or other clinics like that can really help. So in this case, that's where Jason went, and they were able to give him the help that he needed.
So the purpose of this presentation is just to kind of make you aware of the situation and to give you a more practical understanding of it. Because you can make great progress with healthy nutrition, healthy exercise, healthy lifestyle choices, but if you're doing all that and you're still not seeing the results that you should be, then hormone replacement therapy may be something that you should look into. And in order of importance, I would always recommend starting with the exercise and the lifestyle choices and the nutrition first. Like if you're eating like crap, you're not exercising, drinking alcohol, poor lifestyle choices, all that stuff, well, fix that first. Like that's the foundation. Fix the foundation first before you ever go looking into hormone replacement therapy. Like you can't band-aid poor diet and lifestyle with hormones, right? It ain't going to happen. And I've seen this. Like a lot of times people come to me, through the Muscle After 40 Blueprint program, guys who are already taking hormone replacement therapy, and they say, well, I got on hormone replacement therapy because, I qualified for it and I had the symptoms and I figured that the hormones was going to fix the problems. And they're like, well, okay, I do feel better, okay, sexual function is improved, confidence is improved, energy is improved a bit, but I'm still fat and out of shape. Right? Like it ain't going to fix the root problem. So I mean, like if you have poor diet and exercise and lifestyle choices, like fix that first, right? Get that taken care of. And then if you still need further help and optimization, then you can look into the hormone replacement therapy, especially if you're in your middle age years. Like if you're 40 plus, this is something that you should at least be looking into in terms of getting your blood work done and seeing where your hormone levels are. I mean, if they are in the average normal range, then hey, that's fine. But if you're in that low normal or below normal range, then this is something that you should certainly be talking to with your doctor or with a hormone replacement therapy clinic, some specialists who can help you with this. So that's what I'm encouraging you to do. I'm encouraging you to get checked and see if you actually need this stuff, because simply ignoring the symptoms, like the low energy, the low libido, feeling moody and depressed and all that kind of stuff, and just pushing it under the rug and hoping it's going to get better on its own, it ain't going to get better on its own. Like low testosterone does not magically bounce back. It's not something that, hey, give it a few weeks and my testosterone is going to bounce back. No, it naturally declines with age and it ain't coming back. So the only way to get yourself back to optimal levels is with hormone replacement therapy. And like all the supplements that you see at the supplement stores, these so-called testosterone boosters and everything else, the benefits of those are minimum at best. Like it's not a true cure. Like if somebody has low hormones, you're not going to fix it with some over-the-counter herbal supplement. It's not going to happen. But with proper testosterone and hormone replacement therapy, you can get yourself back into those normal optimal ranges that your body should be so that you can live life to the fullest. So if you would like some help with this, I would recommend checking out I Am HRT. And again, that stands for Illinois Alternative Medicine Hormone Replacement Therapy. And you can do a free consultation with them. So how it works, you simply go to their website and you fill out their application and you'll have a virtual consultation with one of their clinicians. And they have a team of medical professionals there who will do a virtual consultation. So you can do this like over the phone, or you can do it like through a Zoom call or something like that, and basically chat to them, and they will diagnose your situation. And again, the initial consultation is free. And if they feel like you are a candidate for this, then they can request labs and blood work, and that is covered by health insurance. And then if it shows that you actually do have low testosterone or low growth hormone or whatever, and they can actually prescribe hormone replacement therapy and do follow-up checkups with you to make sure that you're getting the hormones that you need, and doing so working with you in your situation. So this is something I encourage you to check out if you are a man over the age of 40, or if you have suffered from any of those symptoms, low libido, low energy, low muscle mass, depression, excess body fat, like all that kind of stuff. Despite living a healthy lifestyle, like despite eating clean and exercising and everything else, you're still suffering from this stuff, then this might be what you need to really take things to the next level and to optimize your health and fitness and to live life to the fullest. And several of my personal coaching students are going through this clinic right now to get hormone treatment. So if you are living in the United States and you feel like you could be a candidate for this, then I would recommend check them out. Like I say, they do offer free consultations, and it would be worth it to just see what the numbers are. Like get your blood work done, see where your levels are. If you are in the normal range, then great, stay there, right? That's all ideal. That's where you want to be. But if you are in that low range for any of these critical hormones, then they will provide some alternatives and solutions to help you to get back into those optimal ranges so that you can maximize your overall health and fitness and longevity and basically live life to the fullest. So I hope this video was helpful. If you have any questions, comments, or feedback about this, feel free to post them down in the comments below, and I'll have a chat with you down there. And again, check out IamHRT.com if you want some more information and to actually book a virtual consultation for free. Right, so you can go ahead and do that. No doctor's visits, no awkward conversations or lineups or any of that stuff. Just do it all virtually right from the comfort of your own home through your computer. You can get this stuff checked out and get the ball rolling towards optimizing your hormone levels and living life to the fullest. And make sure to subscribe to the Total Fitness Bodybuilding YouTube channel if you haven't already done so. And I will talk to you in the next video. Take care, over and out.